Hello everyone. Today topic is case presentation on tuberculosis. इसमें सबसे पहले पेशेंट का बायोग्राफिकल डाटा आता है जिसके अंदर नेम ऑफ पेशेंट, एज ऑफ पेशेंट, जेंडर पेशेंट, मेडिकल डायग्नोसिस ट्यूबरकुलोसिस, एजुकेशन स्टेटस ग्रेजुएट, ऑक्यूपेशन प्राइवेट जॉब, मंथली इनकम, रिलीजन, nationality, address, date of admission in hospital, name of hospital, ward number, bed number. इसके बाद चीफ कंप्लेंट ऑफ पेशेंट, सीरियल नंबर, चीफ कंप्लेंट, ड्यूरेशन, प्रीवियस ट्रीटमेंट, ओपीडी, चीफ कंप्लेंट, स्पूटम प्रोडक्शन, ड्यूरेशन 1 to 2 days, previous treatment no, OPD visit after 5 days, chest pain, duration 2 to 3 days, previous treatment no, weakness 3 to 4 days no, difficulty in breathing, duration 4 to 5 days, previous treatment no, present medical history. There is a significant or present medical history of Mr. Sandeep, that is tuberculosis. Past medical history. There is significant or past medical history of Mr. Sandeep, that is fever, rest. Present or past surgical history. There is no significant present and past surgical history of Mr. Sandeep. Vegetarian, non-vegetarian, vegetarian. Number of meal per day 3 times. Any allergy from the food, drug? No. Rest and sleep pattern. Timing of sleep 10 a.m. Any sleep disturbance? No. Duration to time. Type activity of daily living. Tube care of himself? Yes. And need assistant? No. Any problem with activity of daily living? No. Socioeconomic status, family relationship satisfied, marital status satisfied, occupation status employed, any occupation hazard? No. Economic status 3 lakh, and family history of patient. इसमें नेम ऑफ फैमिली मेंबर, रिलेशन विद पेशेंट, एज, सेक्स, एजुकेशन स्टेटस, ऑक्यूपेशन स्टेटस, मैरिज स्टेटस. जगदीश फादर 70 मेल, 10th एजुकेशन स्टेटस, ऑक्यूपेशन रिटायर्ड, मैरिड. रेखा मदर 67, 12 हाउस वाइफ एंड मैरिड. सोनाक्षी वाइफ 34 year old, ग्रेजुएट, प्राइवेट जॉब, मैरिज. राहुल ब्रदर ग्रेजुएट, प्राइवेट जॉब. नमन सन 18 year, student. Family tree: father, mother, brother, patient, wife, son. Investigation: book picture patient, HB, TLC, DLC, SAR, monitor X-ray, CBNAD, chest X-ray. Medication: rampacin, isomoid, ethambutol. Next is tuberculosis. Introduction. TB is a contagious infection that usually attack your lung. It can also spread to other parts of body, life, brain, and spine. A type of bacteria that cause TB are spread when infected person cough or sneeze. Definition: TB is potentially fatal contagious disease that can affect almost every part of the body but is mainly on infection of lungs. Classification: pulmonary TB, extrapulmonary TB, pulmonary TB, primary disease, secondary disease, extrapulmonary disease, lymph node TB, pleural TB, TB of upper airway, skeletal TB, genital urinary tract, parietal cardiac TB, less common forms. Type: active TB disease. Active TB is an illness in which the TB bacteria rapidly multiply and modifying different organ of the body. Malary TB. TB is a rare form of active disease that occur when the TB bacteria find their way into bloodstream in this form of bacteria quickly spread all over the body in tiny. Latent TB infection. Hello TB. Latent TB occur when the person has TB bacteria are present. Extremely small membranes. People with the latent TB are not infection and do not fulfill ill. They are pass the TB bacteria on other people. Symptom: latent TB does have symptom. A skin or the blood test can tell if any sign of the active TB disease include chest pain, coughing of blood, feeling tired, night sweating, chills, fever, loss of appetite, weight. Diagram: bronchi, tachycardia, mycobacterium tuberculosis. Risk factor: HI factor, silicosis, diabetes mellitus, severe kidney disease, low body weight, organ transplant, head and neck cancer, complications, spinal pain, back pain, and stiffness are common complications of tuberculosis. Joint pain, tuberculosis arthritis usually affect the pipe and knee, swelling of the brain, and that causes your brain damage, kidney problem, heart disorder. Cause it tuberculosis is caused by the type of bacterium called Mycobacterium tuberculosis. It is spread when a person without TB is the lungs, cough or sneeze, and someone also inhale the treatment will depend on your infection. If the patient have the latent TB, doctor will give medication to kill the bacteria so the infection does become active. You might get isoniazid, rifampicin, rifampicin, and either alone or combination. A combination of medicine also threat they be the most common are phenolrifampicin, isoniazid acid. Next in nursing diagnose, risk of impaired gas exchange related to destruction of the alcohol capillary membrane as evidenced by chest X-ray examination. Second, imbalanced nutrition less than the body requirement related to fatigue as evidenced by poor muscle deficient or related to cognitive limitation as evidenced by lack of insight follow through obstruction. Risk of active TB bacteria are present in lungs evidenced by sebum and cough present with sputum and blood as evidenced by monitoring patient activity. First, NCP is explained here. Assessment data, subjective data, patient with verbalized that he is having difficulty in breathing in gas exchange. Objective, all observation is observed that exchange problem related to inflammation. Nursing diagnose, impaired gas exchange related to inflammation of airway as evidenced by trachepnea. Goal to reduce inflammation of activity of patient. Planning assess the breathing pattern, depth and rhythm. Absence, skin color of the patient, give nebulize to patient, assess anxiety level of the picture to assess the respiratory distress, cyanosis or nail bed present, necrosis to improve breathing, respiratory hypoxia. Breathing rate is assessed, patient color of the skin observed, nebulize is given, anxiety level is assessed, reduce inflammation of airway of patient as evidenced by tachycardia. Next, nursing diagnose assessment, patient verbalized that he has no knowledge about the disease objective and obstruction, it is observed that the deficient of knowledge. Nursing diagnose knowledge related to the cognitive limitation as evidenced by the lack of the accurate follow through instruction. To clear a doubt of the patient, encourage the patient to verbalize feeling and concern, identify the symptom that should be provided to healthcare provider. Rational provide opportunity to correct the conception, may indicate presence or relation of disease. Implementation, patient had explained feeling symptom repair to healthcare provided to patient, protein and carbohydrate maintain. Evaluation, all doubt clear of the patient as evidenced by the satisfaction. Assessment, subjective data, patient realized to have feeling of weakness, objective had observed that the patient have weakness evidenced by the disease. Imbalance nutritional less than body requirement related to patient have evidence by poor nutrition. Goal to improve imbalanced nutrition, patient monitoring weight, politically encourage and provide for frequent rest period, provide oral care before and respiratory treatment. Rational use useful in meaning effectiveness of nutrition and fluid balance, keep consume energy, reduce the left from sputum. Weight is monitored, rest period is provided, oral care has been given to patient. Patient nutrition balance by the following intervention. So this is case presentation on tuberculosis. Hope you get information from this video. Like the video and comment the video, so share the information for to your friend and subscribe this channel for more video. Thank you for watching my video.